Welcome back. State-of-the-art facilities at rock-bottom prices. Healthcare, the latest business to outsource to the Indian subcontinent. As our Asia correspondent Ian Williams reports from Delhi, British patients frustrated with NHS waiting lists are among the medical tourism pioneers.
Dr. Gulati doing his daily rounds.
Hi, Elliot. How are you doing?
Okay.
His patient is 14-year-old Elliot Knott from Dorchester, who injured his back while ice skating and is now recovering after surgery.
Okay, that's pretty good. I remember when you came, you were like that, weren't you?
Yeah.
Absolutely, yeah. It's good. Let's see you walk.
Doctor and patient are pretty happy with the progress.
We removed your stitches today, and that looks quite good, doesn't it? The wound's quite healed now.
The view from the window of his private room isn't verdant Dorset, but the suburbs of Delhi, where Elliot travelled with his mother after being told they'd have to wait for months for NHS treatment in the UK.
Well, we just kept phoning them up to try and get appointments, and you just felt like you were being fobbed off all the time, really.
It's terrible, really, because I would have probably been like held behind at school a year because I wouldn't have been able to gone in. And I don't know, like a year is a really long time to wait for an operation.
Apollo is India's leading private hospital group, and the cost of treatment here, including airfares, is less than a quarter of the price of private care in the UK.
Great, really, because you can get them to do anything. I even had a McDonald's the other day.
It's fascinating.
Look at these, look. I mean, it was scary still, the thought of coming to India. You know, I must admit, the couple of nights before we came, we didn't really sleep that well.
All right, don't knock it.
No, don't knock it.
For Karen Holman, a special constable with the Bognor Police, it's time for a bit of sightseeing with her husband after a cartilage operation on her knee at the Apollo.
I said to John, let's just go for it. I'd rather travel 8 hours on a plane and actually get someone to look at my knee and deal with it than actually stay at home waiting. Yes, it is cheaper, but that's not the issue. The issue is I've had the operation and I can now get on with my life.
Karen and Elliot were among 4 British health tourists being treated at the Apollo during our visit. And the man who represents the hospital in the UK says the numbers are growing rapidly.
Initially we were getting maybe 20 or so inquiries a month. Now we're getting in excess of 60 to 70 inquiries a day.
It's being made possible by the return to India of doctors like Yash Gulati, who operated on both Karen and Elliot, whose condition was the more complicated.
I remember when he came, he was all bent up. He could not stand, he could not walk because of this slip and the fact that the nerves had been stretched so much. And now he's very comfortable, walking around nicely.
He's UK trained at Liverpool University and worked extensively in the NHS, as have most of the top doctors here. They feel comfortable with British patients, and the British are familiar with Indian doctors, who've been attracted back to India by opportunities that never existed before, equipment as good as anywhere else in the world.
But now everything is available here. Things have, changed so much, and it's on the up. So if you have good opportunities coming here, why would people not come back? I think it is logical. It appeals to common sense.
The doctors here see themselves as pioneers in a new and potentially massive outsourcing business. India wants to do for healthcare what it's already doing for call centres and data processing. And this business could be even bigger.
400 people came from the UK last year, all of them privately, though the Apollo is trying to woo the NHS.
The Apollo Group has been talking to the NHS for, I think, over 2 years now. And we have been offering services in 2 parts. One is that we will treat patients in India. And the other bit is that if you need help in the UK, in your hospitals, in terms of physicians and doctors coming across, we are there to support you.
That may be wishful thinking. The NHS has spurned the offer, claiming waiting lists are falling and citing rules restricting referrals to hospitals within 3 hours flying time. And health tourism isn't without its critics inside India. This is one side of the country those tourists are not likely to see. But for most Indians, this is the reality of healthcare. A dilapidated, poorly funded system struggling to meet the most basic of needs. The Apollo says it is helping the poor, allocating 50 free beds, and is raising overall standards. Though its main target, apart from health tourists, is India's burgeoning middle class.
Ask him to try and avoid spicy food.
As with data processing, India has a huge pool of skilled English-speaking health workers. With an ageing population in the West and spiralling health costs, the growth of India's latest outsourcing business does have a certain inevitability about it. And there are no complaints from the pioneering customers from Britain. Ian Williams, Channel 4 News, Delhi.